Welcome to my podcast. I am Dr. Riz, and I promise to keep it bold, honest, and right to the point because it's happening on my watch. In today's podcast, we're diving into some key differences between traditional Medicare and Medicare Advantage. I'll walk you through each plan and what it covers, some fundamental differences, and share some tips to help new enrollees make the best choice for their healthcare needs, especially because right now it is annual enrollment period. So, in today's agenda, we will talk about original traditional Medicare versus Medicare Advantage. So, the original Medicare is a federal program that provides health insurance for people who are 65 and older, or certain younger people who have disabilities. It includes Part A, which is hospital coverage, and Part B, which is medical coverage. If you need surgery or hospital stay, then Part A helps cover that. If you visit a doctor for a checkup or manage a chronic condition, Part B helps cover those costs. So, where does Medicare Advantage fit in then? Well, Medicare Advantage is offered by private insurance companies approved by Medicare. So, the Centers for Medicare and Medicaid Services has to approve that private company to offer Medicare Advantage. So the Medicare Advantage actually combines Part A, Part B, and usually Part D, which is the prescription drugs. So for instance, instead of managing separate plans for hospital, doctor visits, and prescriptions, a Medicare Advantage plan can cover all three under one policy, sometimes with extra benefits like dental, vision, or transportation. So let's break down this coverage, Part A, B, C, D, all these alphabets, right? So what is Part A? Part A is hospital. Part B is medical. So Part A covers inpatient care, skilled nursing type of care, some health services, home health services. Part B covers outpatient care and doctor's visits, preventive services, and some medical equipment. So, for instance, if you are hospitalized for pneumonia, which is pretty serious, right? So, Part A covers the stay, Part B covers the follow up visits with your doctor and your oxygen machine at home if you need one. Part C combines Part A, Part B, and often Part D. So the Medicare Advantage plans bundle the hospital, Medicare, medical, and usually the prescription drug coverage into one plan. So let's say John has a Medicare Advantage plan. He gets his surgery, doctor visits, and fills the prescriptions all under the same plan. Sometimes even with the coverage for gym membership or dental care. Cost and flexibility comparison between Medicare Advantage and traditional Medicare is also very important. Original Medicare has separate premiums for Part B and Part A if not free, and no out of pocket maximum, meaning costs can add up. Medicare Advantage plans often have lower monthly premiums and an annual out of pocket cap which limits what you pay in a year, right? So let's say Sarah pays $170 for Part B and a separate cost for prescriptions. With Medicare Advantage, she pays $40 a month and won't spend more than $7,500 a year, even with multiple hospital visits. Provider choice and referral rules are also another difference. So, original Medicare allows you to see any doctor who accepts Medicare, no referrals needed. Medicare Advantage, however, often requires using a network of providers and may need referrals to see a specialist. For instance, if you want to see like a cardiologist or a nephrologist, right? So with original Medicare, you can see a cardiologist anywhere as long as they're accepting new patients. With some Medicare Advantage plans, you must see a network cardiologist, get a referral from your primary care doctor. So your primary care doc would have to refer you to a specialist. Only then you can go to that specialist. Some of the extra benefits that are offered by Medicare Advantage plans often include vision, which would include eye exams, glasses. I'm wearing some right now. Dental, cleaning, exams, partial coverage for procedures, hearing exams. Hearing aids can be really expensive. Wellness, gym membership. You can get a free membership to the Y. You could go work out every day and, not have to pay anything. Prescription drugs. Part D is included in some plans. So for instance, Maria joins a Medicare Advantage plan and gets her annual dental cleaning, gets a free gym membership that is included, and on top of that, she gets to see her doctor, which is all included, Part C. The pros and cons for new enrollees and what to consider. So, one thing you have to be very careful about is the monthly premium versus the potential out-of-pocket costs. So, example is that low monthly premium may have higher copays. Provider access is important. So, do you need flexibility to see any doctor, or are you fine with the network? You have to ask those questions to yourself. Like, what kind of environment do you want to function in? If you travel a lot, original Medicare may be better. Prescription needs. Do you take many medications? Example would be like if Medicare Advantage with Part D included, maybe simpler. Extra benefits. Do you care about having all these extra perks like vision or dental or transportation? Do you drive? Do you not drive? Would you like transportation so you could make it to your doctor appointments? Someone who regularly sees a dentist may benefit more from an Advantage plan. Original Medicare is straightforward, but may need supplemental coverage. Advantage plans combine coverage, but may have rules and networks. So let's talk a little bit about what Medicare Advantage offers. So it is like all-in-one coverage, so combines hospital Part A, medical Part B, and usually prescription drugs, which is Part D coverage. So instead of having separate bills for hospital stays, doctor visits, and prescriptions, everything is bundled into one plan. Some plans also include dental, vision, hearing. So let's say a senior could get their annual exam, new eyeglasses covered, along with their regular medication, all under one. Also, Medicare Advantage plans have an out-of-pocket maximum. Medicare Advantage plans will have a yearly cap on what you pay for covered services. Original Medicare does not. So if your plan is capped at $7,500, once you reach that, the plan pays 100% of the covered services for the rest of the year. Now, be mindful of the fact that it's for the year, so every year it resets. In original Medicare, there's no cap. You could face unlimited cost if you have multiple hospital stays. Some of the extra benefits could include perks like transportation, wellness services. A plan might include silver sneakers for gym access, rides to doctor appointments, or even coverage for a massage or an acupuncture session. Um, Coordinated care. is also another advantage of Medicare Advantage plans. So you get to have a care coordinator which would help you navigate through your care and help you, coordinate various appointments or various uh, other benefits that you need to access to get better. Your primary care doctor can help schedule tests, track results, and make sure your medication don't conflict, which can improve preventive care and reduce duplication. So, Medicare Advantage plans usually have a lower upfront cost. Premiums can be lower than combining the original Medicare with Medigap and then Part D. So, for instance, instead of paying $200 a month for Medicaid, Medigap, $50 a month for Part D on top of Medicare, some Medicare Advantage plans may cost between $50 to $100 a month, and that would include everything. So, some relevant factors that need to be, you know, uh, thought about. So Medicare Advantage plans usually have a defined network of doctors, hospitals, and specialists. So if your preferred cardiologist isn't in the network, you might have to switch doctors if you want to stay in the network, or pay significantly more to see an out-of-network doc, because then you'll pay the out-of-network fee. Always check the plan's directory before enrolling. That is important. Also, there are referrals and prior authorizations. Some services require approval from your primary care doc or the insurance plan before you see a specialist or get a procedure. So, for instance, you need to see a dermatologist for a skin condition. Your plan may require your primary doctor to give a referral first. Without it, your visit could be denied or covered just partially, maybe. So make sure to ask your doctor and plan ahead to avoid delays or surprise bills. Varying coverage area. That's a great point. So Medicare Advantage plans are not the same everywhere, and not all Medicare Advantage plans are offered in all the areas. So different areas can have different benefits, premiums, and networks. So they can vary by state or they can vary by county. A plan in Miami may include dental and vision, but the same plan, same type of plan, in Orlando may not. So compare plans carefully in your specific zip code. Don't assume coverage is the nationwide thing, because it may not be. Possible higher costs if seriously ill. So this is a good point here that we need to kind of touch on a little bit, right? So while many Medicare Advantage plans cap annual out-of-pocket costs, frequently what is not covered is out-of-network visits. So if you keep seeing providers out of the network, you will incur extra costs. If you require multiple specialist visits or unexpected emergency care outside the network, you could pay hundreds or even thousands more than expected. So the key here is to stay within the network if you want to save money. So consider your current and anticipated health needs when evaluating a plan. That is important. So traditional Medicare has some advantages. There's always that freedom to choose the providers. You can see any doctor or hospital nationwide that accepts Medicare and is willing to see new patients. There are no network or referral restrictions. So if you live in Florida but spend winters in Arizona, you can visit doctors in both states without changing your plan. You also don't need a referral to see a specialist like cardiologist or a nephrologist. It is predictable and stable coverage. Benefits and rules are standardized and consistent across the US. A hospital stay in New York will be covered the same way as a hospital stay in California. That's a big difference, right? We're talking about two different coasts here, right? So East Coast versus the West Coast. Easier access to specialists. There is no prior authorization. And, you know, which which speeds up care but could inadvertently may increase medical cost, which we will talk about in another session. So for instance, if your primary care doctor recommends an MRI or a visit to an orthopedic surgeon, you can schedule it directly without waiting for approval from an insurance company. Uh, Pairing with Medigap. So if you get supplemental insurance, that plan can help cover most out-of-pocket costs like co-insurances, co-pays, deductibles. So if a hospital stay costs like $2,000 in co-insurance, your Medigap plan can kick in and cover most all of that, reducing any unexpected bills. So that's an advantage there. Some of the provisions of traditional Medicare to bear in mind would include that there is no out-of-pocket maximum. So you never hit like a ceiling. You as just if you have an out-of-pocket and you keep utilizing healthcare services, you will keep paying that out-of-pocket fee. So if you have a major hospital stay or multiple surgeries, your costs could add up to tens of thousands of dollars. So consider pairing original Medicare with Medigap. That's why the Medigap plan is important if you have traditional Medicare, so that any unexpected costs like deductibles or co-insurance can be covered. So the other thing is that separate plans are needed, which includes like Medigap or Part D. So for drugs, you would need to get the Part D prescription coverage so that if you're on different prescription drugs, it could cover that. So that's multiple plans, different premiums, and separate enrollment. I know it sounds confusing, but that is something you're faced with when you are in the traditional Medicare plan, and it's on you to manage all the different coverages, their premiums, their monthly, uh, bills, and all of that. So keep a checklist of what each plan covers to avoid gaps and make sure all your needs are included. Also, the traditional Medicare care does not include vision, dental, or hearing. So routine eye exams, dental cleanings, and hearing aids aren't included. A hearing aid uh, can cost like $3,000 out of pocket if you don't have supplemental coverage. So look into standalone dental, vision, or hearing plans, or check if your Medigap plan offers an optional add-on. That might be a cheaper way to go. Higher total monthly premiums, even though original Medicare has lower base premiums, the total monthly premiums, can add up when you start including extra coverages like Medigap and Part D. So base Medicare might be $170 a month, but Medigap would be another $150 a month, and Part D may be $50 to $60 a month, totaling close to $400 a month. Compare total costs, not just monthly premium, but also potential out-of-pocket spending and coverage benefits. Well, here is a side-by-side comparison between Medicare Advantage and traditional Medicare. So as you can see, we have provider choice. We got referrals needed. We don't have them on the traditional Medicare side, but on the Medicare Advantage side, we do. Medicare Advantage is all-in-one convenience and extra benefits, but may limit provider choice and require network compliance, whereas traditional Medicare has a lot of flexibility, a broader provider network, but potentially higher and less predictable costs. You can find more of this information and in more detail on the CMS website or the Medicare.gov website. I hope this episode helped you better understand your Medicare options. Be sure to subscribe so you don't miss future episodes. And remember, staying informed is really the first step to making the best healthcare decision for you. Healthcare is the most important thing an individual has. So, that's a wrap today's episode of On My Watch with Dr. Riz. Until next time, when we are back on air, breaking down the facts, finances, and future of healthcare, one conversation at a time. Thank you.